For all your embroidery and digitizing needs, call B's Embroidery.
In places where there's been a lot of COVID infection, places like New York and Detroit and other centers where we've seen surges of COVID, we're actually seeing a lot of stroke in those locations. And also, it seems to be that it's actually not in classic situations of stroke, but we're actually seeing young people who don't have the traditional risk factors for stroke, like high blood pressure or other problems. These are young, healthy people that are coming in with big strokes.
Regardless of age or COVID-19, Dr. Hussain says stroke symptoms should never be ignored. He reminds us to use the acronym F.A.S.T to recognize stroke symptoms. B stands for trouble with balance. E is for eyes and vision problems. F for droopiness in the face. A is for arm or leg weakness. S stands for trouble with speech. And T is time, to remind us that time is of the essence and to call 911 quickly. During a stroke, Dr. Hussain says 2 million neurons are lost every minute, so time to treatment matters.
We do have very effective therapies for stroke, but they are time limited. There's a clot buster medication called TPA, which we can give within 4.5 hours. And there are procedures that we can do to remove clots out of blood vessels, but again, we really want to be doing that within the first 6 to 24 hours after a stroke starts. And the longer that it takes to get treatment, potentially the worse someone can do.
Dr. Hussain says some people are afraid to come to the emergency room right now because of COVID-19. However, he says hospitals are taking extra precautions to keep all patients safe. If you or a loved one has stroke symptoms, do not delay care. Seek medical attention immediately.